summary of what's going on with your left knee. What I heard was you had some issues with this right
Oh,
leg.
yeah, I had a spider bite.
Spider bite?
When I was in the hospital.
Oh, scary stuff.
Oh, necrotizing mess.
Oof, not good.
Not good.
So everything's good now, that's healing?
Well, I'm coming here for stretching it, making my foot move again. Yeah.
Oh, this is okay, because he and I were talking about that. Okay.
Sometime I'll show you a picture.
What
We got weekend. Well, I was trying to finish the headstones of my husband's cemetery. Oh, right. So, and the spider sat down the center.
Oh boy, you bitter.
That's it. So, but the knee issue is not so much here, although it clicks when I feel it, but the pain is here. So I'm starting to think it's not meniscus as much as this. But you can tell me.
When does it seem to bother you most?
Standing, walking any distance, and up and down steps, taking steps,
Can you steps?
up
Okay.
and down steps.
Fair enough. All
Always
right.
straight legged.
Always what?
Straight legged.
Straight legged for steps?
Yeah.
Got it. If you don't mind, I'm going to have you put on your shoes there, your sandals again. Yes, very nice.
This one doesn't even.
Need a little help? Let me know.
No, I just can't get it over the top. It's too swollen yet. Can't close it. Better than having not having a foot. Yeah.
A little on skin graft there.
Oh yeah, that's where they took the graft from my foot and ankle. And it still feels like a bad sucker. And that was in January.
Thanks. So if you would, first thing I'm going to do is, so this table is at the lowest setting. I think you'll be able to get from, so we'll observe her getting up from there. Not horrible. Walk towards this way, please. Just going to observe her walking. Let her walk back a little bit towards Brandon, but not all the way.
All right.
So I'd say she's got a little bit of a pirate walk there.
And
So
well,
knees
part of
straight.
it is the right foot doesn't like to move well.
She's got a whole number of things going on, right?
Trying to do.
You can see the effect is she kind of keeps that knee straight quite a bit. Doesn't look quite right. Not horrible, she can get it right. Have a seat, please. Raise this up. So we're going to test a couple of things off the bat. Straighten out your right leg, please. Can I apply pressure right here? Sure. I'm going to test out her front thigh muscle. Hold, don't let me move you. Good, she's rock solid. Now I'm going to have you press up like this. Go ahead, back down. Let it come back down. Push up again. Keep coming, keep coming, keep coming. I'm going to see how she tolerates pressure that you can. So,
Go ahead if you want to do it again.
okay, we're good. Straighten up here, please. I want to see how strong she is on this side. Very hesitant to move. That's the first thing I noticed. You guys notice that? Hold. Hold it, hold it, hold it. Hold it.
I can't do that.
She's got some pain just below the kneecap there. Bend your knee. Push your leg up to straight. Push, 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 push. Okay. Very good. That's not supporting her. So, how that got there, I don't know. She just did that.
Originally, 20 years ago, I fell, hurt my knee here, and the meniscus tear. But they also said, they didn't have, after much doctoring, said they may have linked the bursitis thing. And so that's the painless check.
So I'm starting to collect information here, right? Lying back, please.
On top of that, you're probably using the outline more because.
And because I have to use this leg more than this one gets overused compared to what I'm used to. You on or off?
Take them off.
Okay, just pull it down.
So I'm gonna test out, pull your toes up towards your knees. So she's got a little bit of loss of mobility in her ankles, and like her ankles will be a little more flexible. That's probably not her biggest issue, right? Let that go, please. Take a look at your hip mobility. This thigh should come up to about 110 to 120 degrees. It is. Should have a little bit of out motion, a little bit of in motion. It does. This knee should be able to bend fully and take in range over pressure.
That didn't work. It was actually the outside of the ankle.
And in straightening, pain was in the outside of the ankle, not in the knee. Let that
The
go.
back of the knee.
Relax that.
That's like touching flat, the back of the knee.
Back of the knee is bothersome. Let that relax. I'm going to wiggle her kneecap a little bit
And
here.
that's tender.
That's 10. She's got a patellofemoral disorder. That's the primary thing I believe driving this. And I've seen enough of these that that's the first thing I'm just take a look at, right? There's other things we could consider. I'm going to do a little bit of work to help loosen up your kneecap. This should all be gentle.
Okay.
So I've got my fingers on the inner and outer portion of the kneecap. Her leg up, her knee is a little relaxed. You're going to think this is about as boring as watching paint dry. Because I'm going to do very small adjustments on this. Comfortable so far? There's a little bit left to right. Start to loosen that up. A little bit more underneath that. Get a pillow under there. Here I'm going to do a little bit, trying to train her kneecap to go a little bit more. Actually, this way, you're going south.
Yeah.
The actual
Checklights, yeah.
magnetic field is south towards her head. So she had trauma to her knee a lot of years ago. She had surgery. They thought maybe they did something a little bit that was unfortunate during the procedure. I'm just guessing. Did you ever recover fully from that?
No.
You always feel like you always hobble around a little bit.
Yeah.
She never really fully recovered from that. Did you have some good course of physical therapy after this?
There. Obviously not enough. Or the right time.
Just doing the basics. Like everybody coming from the surgery should be full range of motion, full strength, full use of walking, be confident. Sometimes it's like, yeah, that's good. Do your exercises. It'll get better on its own. That passes for standard care, in my opinion. I'm not going to do a lot here. This has been around for a while. Obviously, it's bothered her for a bit. It might do just a little bit of work through the large knee joint here. So now I'm just working with a large knee joint here just to provide some stimulation, loosen that up. You see, these are the type of forces that you don't need a lot of force. So, and now we're just going to let her leg come down. What's it like to let it rest straight?
Just like this is very comfortable.
So that wasn't comfortable before, is that correct?
More comfortable.
Push your knee down straight again.
Much better.
So she doesn't have any bothersome symptoms. Now she's here. I'm just gonna teach her here while she's here. What do you need, my man?
Just getting some stuff.
All right. Well, can I get something for you?
Don't mind me.
Yeah, I oftentimes
You
just.
just want to get on camera and show his Vikings.
Let's do it. That's right, represent.
Oh, that's exciting fourth quarter.
So, I'll bring on Hornet.
I grew up in Minnesota.
So, he's gonna be insufferable every week the Vikings win. It's gonna be terrible. All right, you're gonna push your knee down straight. That's going to activate the front thighs. That's going to be your first exercise.
I did this in that.
So now she's going to be able to do that a little bit better. She's doing a quadricep. She's just kind of pushing her knee down the straight to activate that front thigh muscle. Kind of like if you ever want to make a muscle to really show it. That's what she's going to do here. So she might have a little better opportunity than that, right?
So you just push your knee down.
I can see the tightening on the top of the thigh.
That's going to be useful for her at this stage, right? It's usually a generally useful exercise, but for her it's going to be real key. We create a bit more movement for the kneecap. Let's have her exercise maybe more in that direction. Does that make sense? Okay. So that's all we're doing today, right?
Okay.
Because I think that if we try to fiddle around with that too much, given that she's had issues for a while, that's not the right issue. She's like, wait a minute. I should have talked and tried to do this at the same time, right? I'm kind of at a loss there, Jerry.
I'll get it.
Okay, sounds good. All right, come on up to seat here. There we go. So now just sit here for a moment. Slide back just a little bit to start with. Straighten out that left knee again. Go a little faster.
Yeah.
Hold the edge of the table. Hold the edge of the table. You swear her and I were
Yeah.
in boots on this.
Yeah.
Now bring it down. Push your leg up again. Sure. Good strength, no matter what. So when you rebalance body tissues, joints, and you teach the body what to do, the body wants to do better, right? But you have to nudge it along, right? No medication in the world, injections going to do that. I'm not totally against that sort of stuff. And full disclosure, I had even this surgery back in the day, right? Come on up, let's see what that's like now.
Good.
I'm just getting smarter. I'm going to try it without the cane.
Well, no, let's have you do the same sort of thing you did. Yeah, let's not get too ahead of ourselves. Let's take a walk. She says, well, should I walk without the cane? And she holds it up.
Yeah.
That's no longer a Captain Hook kind of walking.
I would say so.
Nice. Nice job.
Thank you.
Nice job. So thank you. So yeah, thanks. So.